Hi, I'm Dr. Rajani, and today I'm talking to you about the Quantificare 3D Viewer. It's the most used device in my clinic simply because when patients come in, the number one reason they wouldn't do a treatment is uncertainty, or they're scared about the way they're going to look after the procedure. And this takes that anxiety and that fear and removes it from the consultation process. Thus, patients see their face in 3-dimension, a view they've never seen before, and it allows the conversation between the physician and the patient so that they know you're on the same page and are looking to get the same results thereafter. Thus, you can get wow procedures. Patients come back and do more procedures and will do more quantity at a given sitting of procedures because that fear and anxiety is gone. So it allows you to use the tools that are already existing in your practice today, but use them more often, work smarter, not harder, because you're doing more on less patients, less numbers of patients. Part of the best part is you pay this off in weeks, not months or years. So it's an easy addition to any clinic. I want to show you how I use it in my clinic. So let's go to the video and I'll show you my setup and consultative process and some of the capabilities of the device. So here I'm obtaining the images I need. There's just 4 separate views, and that red dot I focus in those 4 different areas, and it's very easy to do. There's 2 dots, you line them up so there's one single dot, and then I take those images and create a 3D view from the intuitive software. It's very easy to do, and I get the image in just minutes. Now I use a very cheap 42-inch TV, and this wows the patient. You could show them the image on the computer, but once they see it, and I can magnify the areas, the brown spots, the large pores, the texture changes, and where exactly the volume loss is, then I can direct them towards the treatments that are going to give the wow results. And wow results means the patient's much more likely to get further treatments and treat to completion. So here you can see I'm just describing to the patient exactly what we need to do, and I'm getting their input, and they're really seeing their face from a perspective that they've never seen before. So just seeing a simple 3D image that we've constructed is often enough to let the patient know that you care and you know the look that they're going for, and it gives them a wow impression. You can also use the technology for before and afters, and it's a very unique and fun perspective, both from a physician standpoint and the patient standpoint, and you can see the great changes that you've made. You can also use this intuitive, very advanced software to make changes as you're looking, so that the patient knows you're on the same page as they are and you're interested in achieving a similar look as to what they want. This all builds confidence and takes away anxiety from the consultation process and allows you to do the treatments that you know are going to make the best change. You can also use this software for melanin and hemoglobin, so you can show browns or sunspots or red changes in the skin, and you can even measure depth of folds or facial volume loss or volume gain should you choose to do so. Let's listen to a patient. The imaging, how do you feel about it?
I think it's amazing. I see a different side of myself that I actually have never seen before, and your perception is not my perception, and it just gives me a whole area of, it's new. I mean, I haven't seen myself like this before.